Good afternoon, everyone. Welcome to our Tuesday meeting. So I'm glad to see all of you here. And let me share the agenda for today, for today's meeting. So basically, we'll have a list of things to update and discuss. So the first is going to be an update from the Monday meeting, which is on the CEDAR localization. And then we will give an update on the templates and access and control by Putu and also dashboard team. And then we'll have an update from the country coordinators about the template creation. And then HMIS comparison by Yelin, and also the last part is going to be on update on the special issue, and then questions and answers. So basically, this is the agenda today. Professor Miriam, would you like to give a short greeting to open up the meeting as well?
I can do that. It's really good to see everybody. Thank you, Alia. I think that Francesca will chair the meeting, and I will be available to update on the special issue today.
Okay, great.
Yeah, thank you, Professor Miriam, and good afternoon to members of our community, and welcome you to today's meeting. A special thank you to Alia and Putu for, I apologize, there are some people around me causing some noise, but it will soon stop. To thank Alia and Putu for putting together this agenda, and then to everyone for making it to this meeting. So the first item on the agenda will be the updates on the localization meeting of Monday. I think Alia will give that, and Samson, of course, and I know Professor Miriam led yesterday's meeting. She may be able to have some additional information based on the discussion with John. I know Samson will have a presentation as well, but Alia, could you please lead that update for the localization meeting of Monday?
Yes, sure. So basically, last Friday and this Monday, we had a meeting on the CEDAR deployment. So specifically on Friday, we had the technical part with Marcos from the CEDAR team. And then there was like we discussed the technical things regarding the deployment. So basically the things that Samson and Getu were facing at the deployment stages. On yesterday, we discussed two approaches that we would like to have now. So basically, the first one is so the two approaches basically on the deployment part. So the first is deploying CEDAR embeddable editor itself with the core components that will require for the CEDAR embeddable editor. So like terminology service and proxy and etc. So we're figuring out what kind of components still needs to be there. But yesterday we had some clarification on that. So and CEDAR team is helping to solve the issues that we have faced. And then the second approach, which is a backup. So we are also considering the approach of deploying full CEDAR architecture in case of CEDAR embeddable, in case of if the first choice will not be possible to deploy. So basically, this is the main update from the meetings on Friday and Monday. I would also I would like to give the floor to Samson if he wants to add anything to this. Samson, can you hear us?
Thank you, Alia. I'm looking for Samson. I saw Samson earlier in the call. Yes.
Yeah, he is in the call.
Yes, Samson is in
the call. Hi, everyone. Can you hear me?
Yes, Samson.
Yes, good afternoon, good morning. I think Alia summarized it very well. What we are here now is at the stage of deploying CEDAR locally, and so far we're able to run most of the services locally, more than 80% of the services. So we are hoping that we will be looking at how we can customize CEDAR to our needs by minimizing the services, which is one option, like Aliyah said. The other option is building on top of the embeddable editor, because both of them use the CEDAR infrastructure as a basis. What we are doing now is basically an input to both approaches, and we believe in a short time possible, we'll try to converge what's being done, and we hope to see our
Samson? Is it Samson's internet or mine?
Yes, he's speaking, but we can't hear him. I can see him in the microphone is open. Perhaps he has some challenges with the network.
So
I can try to call him, but I can also, again, try to summarize.
Yes, Professor Miriam, please.
So, Samson, I am having the phone here also, so you can correct or also in the chat. But so at the moment we are deploying with two strategies. One is the finalization of the architecture around the embeddable editor, which will be a very lean and clean localized system of CEDAR tailor-made to our purposes. It has some dependencies that were unforeseen, so that is being settled right now by the team, the technical team. Then as a backup position, we have identified the possibility for using the whole CEDAR workbench in a localized format, and we were able to do that, at least Samson and Getu. And they are now identifying how the different services could also be made lean. So I think that we're doing very fine on this strategy and approach. I do think that we could use some more, some variation across the country teams to work with Samson and Getu on, and Aliyah, of course, on the both the programming requirements, but also testing the downloading of the systems, seeing if the manuals would be clear for it. The computer that was used for the deployment of the system was not a particularly advanced one. So if we can be successful there with low bandwidth, then we should generally be good. But it would still be good if there were others who were also working on this and also strengthening the capacity that we're now getting to really in-depth understand the workbench of CEDAR. So Professor Francesca, if we can have a few more technical people working with that team on the CEDAR workbench, I think that could be good. Thank you.
All right, Prof, thank you very much. I have instructed Oluwole as at yesterday to also do the local deployment of CEDAR on his own local PC, so that we'll see. They will get one or two more data stewards from KIU who have not too advanced PCs to also try the deployment, so that we can compare notes and see if we can actually deploy with at least the minimum of hardware in those health facilities.
That's excellent. That's great.
Yes. Yes, we'll take the updates. The second update is still from Aliyah on the templates group and the training of data stewards. Aliyah. Just don't worry about admitting people. I'll handle that while you concentrate on giving your updates, Aliyah.
Okay, thanks, Professor. Last Thursday we had a great meeting with all the data stewards of VODAN community. So basically that session was focused on the demonstration. So each country, like the data stewards from each country were able to share the Excel sheet that they were working on, and also demonstrate how they understood to create vocabularies through Excel sheets and converting to SCOS format. So it was a good practice for all of us, and what was clear to all of us that all the data stewards are quite well prepared for the vocabulary creation. So, and then so this week we basically are going to finalize OPD template, pulling up the terms from the bio portal. And I'm still expecting from country coordinators to submit their assignment. So I have also wrote the message in the chat, so please check it. So that's the update from the last training.
Thank you very much, Aliyah. Thank you for all the excellent work you're doing with the training of the data stewards and on the creation of the templates, and also to thank Miriam and Dr. Sakinat and everyone else who has been assisting you in coordinating the different technical teams in the member countries. Right. We'll take the next update, which is from Putu on the access and control meetings, group meetings of Mondays. Putu, are you there?
So I got a message from he said he has some internet connection issues. So maybe we can leave him by the end of the meeting, so he can have better access and give an update.
All right, we'll wait, and then if Putu doesn't join by the end of the meeting, I can give a brief update because I've been in touch with him on the activities of the access and control group. So I think we can go to Rujan on the machine learning and dashboard group. Rujan.
Yes. So yesterday we had a discussion with John about dashboards and interfacing, and basically what we learned that really VODAN, I mean CEDAR has been built to be what we call agnostic to the front end. So we can just communicate any kind of front end system with the APIs, gather data and terms. So we're really free to choose the technology we want. So like we can make it React or in Angular or even some other open source systems. But I believe from also what I gathered from the team that the preference goes to React. The Denmark team will also be working with that, so we can perhaps communicate with them. We can exchange some ideas, perhaps. We can ask John if we can get into contact. As for the paper on terminology, making really good progress. I expect a draft to be done by the end of this week. Really building a powerful framework to really make sure that all the different knowledge base that's all based on the same terminology. I think that sometimes leads to a bit of confusion. So that is the update for now, and I expect, at the end of the week to really have a good overview, and then we can get feedback.
Okay, thank you very much, Rudwan. So if I may ask, what is the next step now for your team on the dashboard? And is there anything you require from members of the community so we can also drum up support and follow up with them?
Yes, I saw that Gatu drafted a really nice document. So the first thing what we'll do is get the requirements. I think we need to get into contact with some perhaps local health facility experts to really perhaps question what are they their desire. What kind of dashboard do they want? And this is specifically for the team of Jilin. I think he can say more about this. And for the general dashboard, I think, in my opinion, that will be something with the data stewards to discuss, because this is really the overview of the entire VODAN network. And of course, I think that will be a progress of either A/B testing different dashboard layouts, or yeah, just try to prototype and then kind of steer that in a direction that the stakeholders want. But that progress should be pretty rapid. So that is really testing different features, layouts, with different elements on the dashboard. At first, we'll be using just dummy data. And then when we got CEDAR running, then we'll work on integration.
Thank you very much, Ridwan. And I hope the country teams have taken note of the request. But if you could just make a little note on the things you need from the different stakeholders in the community and put that in an email, then we'll have a documentation of what you really need, and we can follow up with the country teams, both from the country leads and then the data stewards. I know that Putu has been in touch with the different country teams, and he has been keeping track of the communication with the health facilities. But if there are specifics of the things you need from the health facilities, actually through Putu as well, he may be able to put you in touch with the best person among the country teams who has been in touch with the health facilities to actually schedule a one-on-one if you want, or an email exchange. I know there has been a lot of communications with the Nigerian health facilities. Uganda, there was a meeting on Saturday. I'm sure Miriam will be reporting on that. Miriam should be reporting in number 5 as a country coordinator for Uganda. And then, of course, Din Jamal and Dr. Sakinat as well for Nigeria and for Ethiopia and for every of the countries where we are implementing. So what if there are some things that are specific, we may be able to identify which of the countries you quickly get those from. Thank you again, Ridwan. Yilin will be speaking number 6, so perhaps he will also give additional inputs to the work of the dashboard group. Next, we'd like to take updates from the different country coordinators. Dr. Wondimu is on the call. If you can provide updates on the templates creation, or you have Agichu or Ephraim who is on your team, you can call on who has been leading that in Ethiopia to provide an update. Dr. Wondimu. Is there someone who will speak for the Ethiopia team? Aliyah, who is the technical coordinator for Ethiopia?
Nurse. Oh, sorry. For the.
I think Ernest is writing exams. He told me.
But we have Ephraim here.
Ephraim, yeah.
And Ephraim.
I had okay, Ernest is here. Yes.
Hello.
Yes, Dr. Wondimu.
Hi, how are you? Sorry, my connection has some problems, so that's why I couldn't talk. Okay, just to briefly update from Ethiopian side, we are progressing well so far. We have developed action plan and discussed with Prof. Miriam, and also share with among the team, and we have also conducting the first communication with sub-city data focal person, and they have developed the orientation is given for the data focal person, and now they are communicating the respective health facilities based on the tool. I hope they will finish very soon, and maybe Ephraim also will add some additional pointers. So this is my brief update from my side. I would like also to to give a chance to Ephraim. Maybe you can add some points. Thank you.
Thank you, Dr. Wandimon. Yes, perhaps Ephraim can give updates on the templates creation for Ethiopia. Or otherwise, Ephraim or Ernest, who is the technical coordinator for Ethiopia, one of the two. Ephraim is on the call. Hi, Ephraim.
Hi, Prof. I have nothing to add about the template creation, but say something about the communication, the first round communication. We have assigned 3 health information technicians from the subcity to coordinate and to conduct the first round communication for the health facilities. And we updated yesterday for Putu, just to add it now. Thank you.
Yes, thank you very much, Ephraim. I'm sure we'll still want to know about the template creation for Ethiopia. Perhaps Ernest, if you can unmute and then provide a brief update.
Also, Tigist is
Right, Tigist is on the call. I'm looking at, I don't have Tigist on the call. Okay, Ernest, your mic is open. Yes. Is Ernest speaking? All right, I guess we can go to, before Din Jamal, Mariam, is Mariam on the, okay.
Yeah.
Right.
The one I'm handling is like not a
Ernest, I cannot hear that. I couldn't get anything. Perhaps to
Can
find
you
it
hear what
better.
I'm saying now?
Okay.
Yeah, I said what I'm handling is Liberia, not Ethiopia.
Liberia, oh, my apologies, please. My apologies.
Okay.
Right. Okay, so when we get to Liberia, I will call you to speak. Perhaps Miriam can speak for Uganda. Is Miriam on the call?
Yes, I'm on the call. Hi,
Hi,
everyone.
Mariam.
Hello, hi, Francisca. So, with the Ugandan team, the template is actually ready. However, the data stewards are currently using the CEDAR platform as a playground to be able to create the templates, and they're also practicing with the vocabulary creation. We plan to have a meeting this week as well, before end of this week. And then with regards to the access and control, I had a meeting with the directors from the different hospitals this weekend on Sunday, or actually on Saturday. And 3 directors attended, one from Holy Innocents Children's Hospital, the other from Liantonde, and Chibuli Hospital as well. So, and we basically resorted to having another meeting with the data management personnel present at the meeting, and together with some of the other hospitals. That's one of the hospitals that actually responded but could not attend the meeting. So we intend to have another meeting this week with the directors together with the data management personnel, and then we'll move forward from that point. So that's basically the update from Uganda.
Yeah, thank you very much, Mariam, for the excellent update from Uganda. Thanks to you and the data steward for the excellent work that is being done. I would like to call on Din Jamal. On Monday, I was at the access and control meeting, and then I was talking to Putu afterwards, and we want to see, we know Din Jamal is so much want to get started in Somalia, and we just need to put together our technical tools now so that we can deploy in that country. But we'd like to have an update from Din Jamal if he's on the call.
so much, Professor. Our update in last week, we first of all we appointed the desk focal points of the 5 selected health facilities, and they are ready. This is number 1, and that was the most complicated activity that we have done the last week. And right now the data. The second update is that we conducted communication exercise, facility communication exercise. We conducted 5 communication exercises. We're obtaining the basic information of the health facility that we go into to pilot the project. And I think it's 1 hospital and 5 health facility. Findings with the Bhutto. I think I have shared 1, and the rest I will share with him tonight or tomorrow. We are going to write down into the computer. And the most important thing in the communication, facility communication, was the data. They just discussed about what they wanted to, what kind of support that they need to find from this project, which is mainly about they have indicators that they report on monthly basis. So, for example, in OBD, they requested that children with diarrhea, children with pneumonia, also a referral number of beds. So they just left their share that that update with Moto to put in the upcoming communication with the technicals. And also in terms of completion of templates, and it was supposed to meet with Tickety yesterday, but we didn't meet. I think we'll meet tomorrow to finalize the vocabulary and also the template. So we have a plan to complete all the related template to this week, for the end of this week. Friday, I think it will be ready. I think I mean,
Thank you, Dean Jamal. I hope the updates I was able to make that the program is on track in Somalia, and you'll be meeting with Tigis to finalize on the template creation. Okay, Dean Jamal is trying to come back in, but we can move to Dr. Reginald for Kenya, Dr. Reginald and William for Kenya, to give an update on the country and the template creation for Kenya. Dr. Reginald, you have the floor, please.
Thank you very much, Professor, and thanks to everyone for this opportunity. First of all, is the template creation exercise has been very good. William has done a good job and he was able to demonstrate. And now what remains is to do the same exercise with the health facilities. Zambezi and Beacon of Hope are ready for this exercise, and the directors are very supportive. Then the exercise, we have been able to work on that, and then we are hoping that we can keep improving, because it's a good search in different hospitals, different health facilities, to harmonize and see where we might see some gaps and improve on the OPDs. On the side of access and control, I think Nairobi Metropolitan Service, that's the Ministry of Health government office that's running all the health facilities in Nairobi County, are very supportive. I've just seen an email asking for a consultative meeting this Thursday, and I hope Professor Francisca will be able to join in, and Professor Miriam, Kenya time, 10 a.m. to 11. I think for them, what they just want to say is that they're ready, collaborate with us, they're ready to sign the agreement. Then they are going to suggest which hospitals to work with. And I think I would say that we are on track. Thank you, Professor.
Thank you very much, Dr. Reginald, for the progress report from Kenya. Dr. Bernard, Professor Bernard from Zimbabwe, could you kindly give an update on the template creation in Zimbabwe and then the situation generally with the implementation of the project?
Hello, good afternoon. Hello, are you hearing me?
You're breaking a bit. I have difficulties. I don't know about others, but for me, I have difficulties hearing you. Perhaps you can give the updates in the chat.
Hello, it's now clear?
Yeah, it's breaking a little. It's breaking. It gets better and then it breaks again. Dr. Bernard? Okay, I think he left. Perhaps before he comes back in, if we take for Tanzania, Dr. Jeremiah is not here. Professor Miriam, are you able to give an update for Tanzania?
Yes, I can. Yes, I can also update, I think, on
Zimbabwe.
Zimbabwe, the issues being resolved of the clearance. So we still.
Hello.
Please go ahead, Dr. Bennett, please. If not, Doctor, please type in the chat. I think I'll continue. The Zimbabwe team is getting the clearance at the moment, so we should still expect them to be there. Liberia, we have had a lot of information from them over the weekend, which I have given to Putu most in particular. Dr. Tebeke has two data stewards, and he is very much engaging together with Dr. Wondimu, who is at the moment in Monrovia. And it has also been cleared with a higher level. So that is good. Tanzania, I haven't been in touch, but I think that maybe Aliyah is in touch with Dr. Jeremiah.
Right, Aliyah, would you have any update to give?
So basically so the template, which is on the desk registration form, is on the CEDAR platform. And I hope to have a meeting with Dr. Jeremiah tomorrow or day after tomorrow. So in order to discuss here and finalize the template. So, but the template is almost ready. Yeah.
Thank you very much, Aliyah. Thank you. You could, I don't know what time your meeting with Dr. Jeremiah is, but if you could just do an email update so that if there are things that we need to work on within the community, you kindly let me know. Thank you. Dr. Sakinat for Nigeria and Malam Kawu. Dr. Sakinat, please, could you give an update on the template creation in Nigeria and then the general update on the implementation in Nigeria?
Yeah, thank you, Professor Francisca. Hello, everyone. Professor Mijam, good afternoon. For Nigeria, the ontology creation all data stewards have mastered that with the Excel sheet and creating the .ttl document. All our data steward have mastered that. But for the template creation on CEDAR, we still have a bit of a challenge with one or two of our data steward, and I think that by this weekend we are going to perfect that. And as for our hospitals, the 6 hospitals are very ready, and we are waiting for order from you, Professor Francisca. And some of the questions that Putu asked for the information, we are in the process of getting some of the information. We already sent them out to the hospital, so we are expecting feedback from those hospitals. So I know that Dr. Abdullah is on the call, so I don't know if you would like to add one or two things to what I've just said. Dr. Abdullah.
Yeah, Dr. Abdullah.
Kawu can talk if he's not available.
I'm here.
Yes, do you have anything to add to what I just said?
No, not much. I think, like you mentioned, we've had contacts with our health facilities. We were only waiting on some clearances from government to advance and get those health facilities to create templates and also have access to the OPD registers some of these facilities have. Because at this time, we only have OPD register for 3 facilities. And our pilot facilities are 6 for now. So yeah, but when we get those clearances, they will probably follow almost immediately. Yes, I think that's just what I want to add.
Thank you very much, Malam Kawu and Dr. Sakinat. Something now that we have gone around all the countries, I don't think any country is left. One other thing that is outstanding from my side is on the issue of the payment and the contracting for the new data stewards and then those who are already part of the community. I was actually waiting because now we have made the budget, which I have shared with the country leads, but then there might be need for certain revisions until all the information on the facilities is completed with Putu. It may be hard for me to make the request to the VODAN Africa administration in Brussels for the payment, because now after making payment and then something changes, so it becomes difficult for us to reconcile things. That is why we seem to be stalling a little, or I seem to be stalling a little on the contract. We need to know the actual number of hospitals and the health facilities at this time. Putu has not given his update. I don't know if Putu is ready to give his updates now. And as part of his updates on the access and control, it would be good if he would also let us know the minimum things that he requires from each of the facilities, so that as soon as he gets all these minimum things, then we can go ahead with the contracting for both the old members of our community and the new data stewards, and I can send a request for the funding for those things that will be contracted by VODAN Africa in Brussels and the ones that will be handled by the country coordinators locally. I know I've been in touch with Dr. Sakinat because for Nigeria, the budget is still not straightforward as well, to consolidate on the number of data stewards and get that information across to me. Is Putu back online now? Yes, Putu, please.
Yes, I'm here, Professor
Thank you,
Francisca.
Putu. Go ahead. Thank you, Putu. You may share your screen if you wish.
Yeah, I will share on my screen. I want to share my screen, of course. So, Alia, can you? Alia, can you give it? Okay, thank you. So yesterday we had a discussion about, as always, update communication and also communication topic list. So this is the overview of the result of communication with the health facilities. So from Uganda, already met 3 directors from 3 health facilities, and Mariam is preparing for communication topic list discussion question, and from Zambezi and Beacon Hospital, and from Zimbabwe, Kuda is not there, so I don't know what is the last update. I will contact him individually. From Somalia, I just got information. So Din Jamal told me that they are finished with the first round data collection from first round of communication result from Gacan Libah Health Center. And Abdullahi, just like Abdullahi stated before, that Abdullahi have an appointment with the medical director of IBB University clinic on Wednesday, and make appointment with the government facilities. And from the Ethiopia, EPROM selected 3 health information technicians from 3 sub-cities to communicate the health facilities and provide orientation to them to start the communication topic list with, to the health facilities. So basically, yesterday I re-explained about repeat the explanation of a general communication step. I think there is no question about this. So we are now some of health facilities is still in the first phase, so still communicate to get approval or a clearance from the Ministry of Health, and some of them are in this second phase. So we can we already identify this data steward and discuss and have a conversation about the first round of question. And Kenya already collected to answer of from 2 health facilities about the communication topic list, and 1 from Somalia. So I think we will I will encourage Kenya and Somalia to move to the second round, but I will have a discussion with each coordinator. And after that update, I will collect the data in this Google Sheet, but it is individual Google Sheet, so I just share it with the health facility communicator and country coordinator. So I will collect all of the information, and then the next step is still there are two activities. There are 2 parallel activities. So first is still communicating with the health facilities, and the second activity is to communicate the communication topic list, have a conversation about the communication topic list, to know the condition or identify the situation in the health facilities. So that's all, Professor Francisca, from my side. Back to you.
Thank you very much, Putu, for this excellent update. And then I hope the country teams have taken note of what they need to do. Thank you, too. I think from Alia's sharing of the agenda, Yilin should give an update on the comparison of HMIs. Yilin, please.
Yes, sure, Professor Francisca. About the HMIS comparison update, I think we've got some helpful information from the interview launched in Kenya during the first round communication. And I think more and more information will be obtained along with the proceeding of interviews. Then I would say the next step would be I'm going to discuss with Putu about more questions regarding deeper details that might be useful. And I think I'm also going to try to communicate with country coordinator 1 by 1 in order to make sure that we don't miss any information. And this is about my update. Thank you.
Yes, thank you very much, Yilin. That's an excellent one. Perhaps Professor Miriam, you like to speak to some of this. And of course, you were active in yesterday's meeting with John. If you'd like to provide some update on the tooling for the community.
Oh, no, not in, thank you, Francesca. Not in addition to what has already been said, is well covered. I would like to suggest that Saifete Nurullah is here every week, that he is properly integrated in the team. He will be starting in an exchange program with Leiden, LUMC, in July, but he's already available and he'll be full-time available. He's AI. So together with Rudwan, the team of Dr. Sakinat, he can really work on the measures and the pipeline. So yeah, I don't know if there can be contact between Saifetten and either Rudwan or Dr. Sakinat. That would be good. Rudwan, maybe, yeah, maybe Rudwan, you could take contact with Saifetten and see how to integrate him in the team.
That sounds good. I will need the contact details. So
yeah, he's in the chat, so you can just exchange right now in the chat.
Yes, Nurullah, if you could just send your email to Rudwan so that you continue the conversation. Yes, thank you very much.
The call name is Saifetten, just so that we all know we are talking about the same person.
Right.
Yeah.
Right, Nurullah, the same person.
That is that. Then I can maybe continue with the update on the publications. Well, some very good news. First good news is that I'm just here on my other screen responding to the one last question from Advanced Genetics, and then that will be published this week. Next week, we'll have the article in the next days or so. So that is very, very good news. And I also have spoken to Feng Hong, and she says greetings to everybody. She's very, very fine and very excited about publishing the special issue. Aliyah, if you can allow me to share my screen, then I will show everybody where we are on this. So this one. No, well, this is what you see. Is this right? What is happening to my screens? Sorry. Now I've lost my screen here. You are seeing my screen. Are you seeing my screen?
Yes, Prof, we can see your screen.
Are you seeing?
Yes, you can see this.
Oh, are you seeing the whole of my screen?
Yes.
So if I do like this, you see it better, right?
Right, Prof.
Okay. So this is special issue 1. We have to still do the article of the overview, but now that we're getting to the next part, this will be the next job. This is the article. I need to maybe change this. Rudwan, this is you. This is the article on terminology. I know Aliyah has worked on it. I would expect Mariam to do some work on it. So I have just added some names randomly. It goes, of course, according to author rules. But I suggest that will be article 2 because it's on terminology. And so I think before we start, we need to set out the terminology. And then I will ask Susan, our editor, to make sure that all of the articles that follow will then work with the definitions of terminology as we have agreed it. So this will be coming back here, and we will make sure that we have consensus on this.
It sounds good.
Yeah, good. Yeah, and I also should say the good news that data intelligence has just been included in Scopus and Web of Science. So Feng Hong was really very happy with that.
A small correction, by the way.
Yes.
Yan Liang will also be contributing to that article too.
Yeah, we just
enlisted her help. So
Yeah, that's good.
Send it.
Yeah, we will finalize that one. That is just from now. And also for anyone who is wanting to use the articles in other articles that you are writing as reference, from now on, I should change it here too. It is Data Intelligence Volume 3. We will be Volume 3. That has been assigned to us. So that's also good news. Then this is the article of Mariam and co, which is really the overview article of how we came to the proof of concept and the conclusions that we drew from it. So it will be Article 3 in my proposal. Then we go on with the idea of equivalency, which started with Mariam. So that would be Article 4. It is the old Article 6. Then followed by Indonesia, by Ethiopia, by...
Yeah, Prof. Hello.
Sakinat.
Yes. Please, can you go up just one step? I think, okay, Article 8. My name, that's Folorun, so there's no H there.
Yeah, I'm going to send this around to everybody to check it. So thank you for that.
Yes.
This is not final. This is just to give everybody the overview. And sorry for the spelling error. So here we have Nigeria. We have here Kenya. So Ino, Esther is working on this very hard so that we are not delayed by this one article. And then that is also followed by the article of Putu and co on the comparison between fair and open data. I still need to hear from Inau, from Esther, whether we would add here the article comparing fair and smart. That would fit, but is it feasible? That is the question.
Mm-hmm. Misha just sent me.
Yes.
Misha just sent me an email about what you just asked. Is it feasible within the time frame? Honestly, I think not.
Yeah.
I think we might have to put it in the next issue if it's still possible.
It is possible. I mean, it's an important issue. I think the article is important, and in as far as we don't have it with this timeline, we will plan it for any of the following issues. So there's no worry. You continue, and we should also not be overly stressed out. But I wanted to recognize that it's a good article to have. Then we continue with the health information streams in the clinics, the article of Mariam and colleague, then Aliyah on the assessment of compliance and adoption potential in Kazakhstan. And then we continue with the details of the design this is basically the learnings from the VODAN in a box here, this one. This is the article on the data access and control, the arrangements on permissions. Here, very important, the update of the research data and the learnings that we had from that by Dr. Mariam and team. Then we go on to digital interoperability by Mariam. And then we continue with the articles on the capacity building. And then some important articles in relation to the use for machine learning, the policy behind the inclusion of FAIR for the purpose, and the article on implementation in non-English geographies, which I also have here on my screen. So all of these articles are basically done. This one is being worked at. I don't know, Dr. Reginald, I know, is working very hard on this. And this one, I was just asking Dr. Bernard for an update on it. So now I have a question still to the group. Feng Hong was asking whether or not we would do a double peer review. For the purpose of Feng Hong, it's not necessary. It has not happened with earlier versions. and it would speed up things. The moment that she has the article, in a week time, she'll be able to publish. However, from my consideration, since many of the authors are first authors and PhD candidates, my feeling is that it is in the interest of the authors to have a double-blind peer review, which of course is going to delay us, but then makes the articles more eligible for PhD consideration. So I would like to ask the meeting what your opinion is on this. I have said to Feng Hong that I think that it is in the interest of the PhDs to have a double-blind peer review, but does the meeting agree? I can revert. There is no problem if the meeting would think differently. So maybe in chat you can identify, and feel free to identify any opinion on this. Or maybe I freaked everybody out on this question. What do you think, Francesca? Prof?
I think the major beneficiaries of this are the PhD candidates, so we leave them to take that decision. We can only guide.
Yes,
I know they are in a hurry to publish, but then it's important that they have a peer review so that it can count for them.
Yeah, but we have to have a policy for the whole special issue.
All right, right. I worry, I know it's good to do things to do it well, and I know the articles have been done well, but have we not really missed our timeline on the publication?
We don't necessarily need to miss if we do the double-blind peer review fast. So if we just really do this in the next 2 weeks, we could be done.
In that case, I think that's fine then. I will say, let us have the double peer review if it's not going to really slow us down. And even if it slows us down, good things are better done well.
Yeah, and Rudewan is saying it will be really beneficial in the long term. I think that too. I was going to make some proposal on the peer review, but let me first check availability. Mariam is also saying we should have the double peer review. Well, any Gitu, I agree. Aliyah,
Everyone is agreeing. That's fine.
So if everybody agrees on that,
agrees,
July, featuring on Scopus, yeah. Okay, I think all our PhD students are agreeing. So then I think we should go with that. Yelene as well. Okay, then that's a decision. So I will work on that. If you allow me, I will work on the peer reviewers and the timeline and Feng Hong. And just for anybody with an article that is not yet gone to Susan, it is very, very important now, because anything that is not ready before time will now be dropped for this special issue.
Right.
Do we have a strict deadline? Rudewan, you started late, and we really all want that article, so I'm going to trail that at the end.
I mean, sorry, do we have a date? That's what I meant.
Yeah, I know. So I would, and that's also important for you now. So I think if we can work with the next 2 to 3 weeks, we could still manage, and that we really, in the summer, in July, we start publishing.
Oh yeah, that was my concern. Like,
Absolutely.
Yeah, sorry, my draft will be finished probably by the end of this week, so that should be on time.
Yeah, and as for the authors, Rudewan, you are in charge as first author, so that's open. That was just here for sharing that it is not just you, and that there will be other authors on it.
Okay, thank you.
Okay, then last thing is that I will share this document in the chat, And if there is any correction, if you can send that to Misha, you can always put me in copy, but then we'll make sure that all the information is exactly as it should be.
Okay.
That is it, Francesca.
Thank you very much, Prof. I know we have been talking so much about health facilities and clinics, and then we seem to forget our team on research data, but then I wouldn't want us to hurry over things. So I would like to put Professor Mariam Gadalu and Zora on notice that by next week, we would like to have a comprehensive update from their team. I don't mind if that is the major thing we're going to do for next week, Tuesday, for our meeting, but it would be good that we have an update from that team of Professor Mariam. Professor Miriam, I think you agree with that we need to hear from the team on research data to know the progress of their terminologies and then the implementation.
Yeah, because I don't know, Dr. Mariam, if you are hearing us.
Yes, she's here. She said, okay.
Yeah, the integration of your program into the overall is really very important. And next week, we can also show one of the new figures that Obina has made, which shows and which should be, it is the key figure in advanced genetics and should also be the key figure in the special issue. So let's put that on the agenda for next week so that we have a clear, comprehensive overview, which very much should include the work of Tunisia. One practical question, is the Tunisia team in the training of Aliyah on the template development?
No, I don't think so. Aliyah? Aliyah, do you usually have the Tunisia team in the templates training? No.
So can Aliyah, maybe bilaterally we can discuss the updates in relation to Tunisia, in relation to Liberia also, so that we know how to integrate them. We'll do that together this week.
Yes, thank you very much, Professor Miriam. So I think I'll leave it to Aliyah or Putu to close the meeting now. I apologize that we're 5 minutes over.
Francesca, just give me, give me one moment to share, because everybody is here, to share in the chat, or shall I share in WhatsApp?
Yes.
I can do in WhatsApp, right?
Yes, you can do in WhatsApp,
okay.
yes.
All right, then I'm good.
Thank you very much. So Aliyah, I'll just leave you to make the closing announcement and then it's goodbye from me. Thank you.
Thank you, Professor Francesca, and thank you everyone for the updates that you made and your contribution that you are making to this community. So with this one, I would like to close the meeting and then I will send the recording later this week. So I wish you a wonderful week and bye.